The thing is, what I've noticed with, especially when it comes to autoimmune conditions, there's this uh, idea that it is all genetic, right? That there's nothing that I can really do about my autoimmune condition, and especially when it comes to toxins, we we have three phases really in our detoxifying process. And yes, your genetics will play a role in you developing autoimmune conditions, but we don't necessarily have a gene, a specific gene for Hashimoto's or specific for fibromyalgia, right? We do have genes that could put us at higher risk of developing autoimmune disease. And one of the gene sort of SNPs that come up quite a lot in my clients are the SNPs that interfere with your detoxification process. And that is something that can put us at higher risk.
Yes.
So can you dive a little bit deeper into this for us? What is the sort of three phases of detoxification that happen in the body? And how do our genetics really play into affecting that?
The genetics, I look at genetics as a recipe book. And genetics tells you if your body's going to break down, which pathway of disease are you going to walk down? Some people it's diabetes, some people it's cancer, some people it's autoimmunity. But your genetics are not your destiny. It's, another analogy that I've heard over and over again, which I absolutely love, is that genetics loads the gun, but your environment pulls the trigger. So you can walk around with a loaded gun your whole life and have family risk of certain medical problems. But if you take care of yourself and clean up your environment, you never pull the trigger. Another thing with genetics, though, is as I look at health as a bucket. So we're given a bucket at birth, and that bucket signifies how well we adapt and detoxify.
Okay.
And the genetics part is that we all have a different size bucket. So some people have a little bucket and some people have a great big bucket. The principle is if your bucket overflows, you get sick. You get whatever illness you're predestined by your genetics to get. So the 95-year-old man who smokes and drinks and doesn't eat right and dies in his sleep without ever getting a medical problem, he's got a great big bucket. And then the 45-year-old woman who tries to eat right and exercise and do these things and ends up with breast cancer, she has a very small bucket. But the principle is the same. If we can reduce what's going into our bucket so that it doesn't overflow, then we can prevent the illness. So what fills the bucket? Stress, poor nutrition, and toxins. And so if we look at it that way, some people, with the amount of stress they have, they can't handle many toxins, and other people have the ability to detoxify better so they can handle more toxins. But when I get to know, that's why you have to do the personalized medicine, right? Because we're not all walking around with the same size bucket. We have that individuality, and some people are going to get sick living right next door to somebody who's not sick in the same environment. And it could be the toxins that are leading to that, but it has to do with what else is in that person's bucket and how big their bucket is genetically.